The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Casino. There's no place like Hollywood. And by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Hello and welcome to Spectrum Generations. We're so excited to bring you programs that make a difference to you as you live, laugh, and learn. And today we're really going to learn because October is special for many, many things. I love fall in Maine. However, it's a challenging time to learn about Medicare. So we have brought the three best experts around to help us figure out a lot of questions. We're going to do our program today based on questions that have been called in over and over to Spectrum Generations. I suspect you've heard them many times. I'm going to introduce you a little bit differently. I'm going to introduce you all first because you're all very special, but I want to know a little bit about what you do so we'll know who is our expert panel today. First I have Gloria Rhode, Community Service Program Manager of Spectrum Generations, and I suspect you have many calls coming your way. So I'm going to come back to ask about you. Then we have Betty Balderson, and Betty has a different job. She's a statewide coordinator of Maine Senior Medicare Patrol. I love the name. I can't wait to hear more about that. And then Caroline Zimmerman works with federally qualified health centers and can talk to us about that, because each of you have a very good perspective on what people need to know about Medicare this month. So I'm going to start with you, Gloria. First of all, tell me what you do.
Well, I work for Spectrum Generations. I'm a consumer information program supervisor, but I'm also a consumer information specialist. So I work out of the Rockland office, covering all of Knox County, providing people in that area with information about a variety of topics and issues.
And Medicare is a big deal right now, and why is that?
It's a big deal right now because we're fast approaching the annual enrollment period, which begins on October 15th and runs through December 7th. And that's the one opportunity every year when people have to make a change to their existing prescription drug coverage or Medicare Advantage type coverage. So
it's an opportunity to make things a little better for yourself or to sign up for the first time for the best thing for you, and it's complicated without your help.
That's true.
All right. And how about you, Betty? Tell us a little bit about what you do and explain your title.
Well, the Maine Senior Medicare program is a statewide program that's federally funded, and we educate people about Medicare and how they can avoid or report suspected healthcare fraud.
So, but you also help people understand their options around Medicare during the month of October. Is that part of your job?
Not so much.
Not so much.
However,
but you know the program because of what you do.
Yes.
And how does that work with you with the federally qualified? First of all, what is a federally qualified health center?
Sure. A federally qualified health center is a community health center. It's a primary care clinic. We have locations all around the state. We serve over 180,000 patients, many of whom are Medicare beneficiaries.
In Maine.
In Maine, all the way from York to Aroostook and Washington County and everywhere in between.
Right. And is anybody in Maine eligible to participate in a federally qualified health center if there's one nearby?
Absolutely. Anybody in the community is eligible to go and get your primary care at the community health center.
And so you know quite a bit about Medicare because your patients probably have questions of you as well when they come to see you.
Yes, absolutely. And our providers as well really need to know what's coming up in Medicare so that they can serve their patients the best they can.
Yeah, and we've had changes out there, and I'm sure you'll all address that in terms of everybody's wondering, well, what does this mean? What happened in Washington? What happened in Maine? How does that affect me? This is an important time. Now we're going to turn to the questions that the viewers seem to most want to know. No stranger to you, because that's what you do all the time, right? You answer consumer questions. Right. But it is interesting how you can compile questions because it seems that we all have similar ones. Mm-hmm. And so here's the first one that comes in a lot, and you can understand it. I hear a lot of talk and TV announcements about the Medicare Part D annual enrollment time is now. What does that mean? does every Medicare beneficiary need to do this? For example, I'm on Medicare. Do I need to do anything?
Well, it's the one time you're going to get every year to look at the plan that you currently have,
Right.
and compare that plan to plans that are going to be available to you next year, beginning in January. And I always advise people that call me that it really is a good idea to check that out and compare what's coming up to what you have, because even though the plan you have this year might be working pretty well for you, the plans also have an opportunity to make a change.
Okay.
So they could change the monthly premium they charge, they could add a deductible, they could change medications that they're going to cover next year.
So even the plan you have might change, be
That's
changing.
right.
So you'd better, it's a tune-up, you better look.
That's right. It's a good idea to check it out and make sure that you're going to have something for next year that's going to work well and cover your medication.
Okay, I'm going to ask you the hard question. It's not on this paper. How many options am I going to have to choose from?
Well, typically what we've seen in the past is there's around 30 different options, and every one of those plans covers different medications at a different dosage at a different cost. And they all have different monthly premiums. Some have deductibles, some don't. So, you know, there are a lot of choices.
All right, I'm going to stop asking my questions. I could go on with you forever. Is there anything you'd like to add to that? The importance of this time, as I understand, it's October 15th through December 7th. That's the big magic window.
That's right.
And if you don't make a decision or a change in that window, you have to wait till next year. Is that correct? Okay, so that's the first important thing. Is there anything else you'd like to add to what Gloria has said?
I think in terms of folks with community health centers in their area, they can also help with enrollment support. Spectrum and all the AAAs are a great resource, but don't forget about your primary care office, because they
Okay,
can
that's
help.
a good advice, because I'm sure there are lots of people who have questions and they need answers right away. Well, let's try another one. This is federal talk again. The Affordable Care Act was passed in 2010. How has that impacted Medicare?
Sure. Well, I'll start off.
All right.
One of the most visible benefits to Medicare members has been an increase in free preventive services to members.
Okay.
So screenings
Give me
like...
an example, a screening.
Yeah, screenings such as breast and cervical cancer screening, colorectal cancer screening, or bone mass measurement.
Wow.
Those screening services are free to Medicare members right now.
No copay, because it's so important in preventing the
Correct.
horrible disease that could follow.
Absolutely. The only thing to note is that even though the screening is free, if you need a follow-up service or lab test, that might be a separate cost. So it's important to check with your provider
Okay, so
about that.
one of the changes is funding for preventive care. Anything else that's impacted folks here in Maine concerning that change?
Absolutely. Well, we're talking about Part D. For folks that entered the donut hole who have Part D,
Do you mind reminding us what the donut hole is?
sure, I don't know if you'd like to.
Well, all of the Medicare drug plans are set up in a similar fashion in that they will cover you at a certain level
Okay.
until a certain dollar amount has been spent by both you and the plan to
Okay.
cover the cost of your medication. Once you've reached that amount, then there's a gap in coverage, or some people call it a donut
A
hole.
donut hole, and that's when you're responsible for everything.
Well, it used to be that you were responsible for everything, but
no
one
more.
of the changes is that,
This is the 2010 Act, okay?
right, you know, that Medicare is going to cover more and more of that cost during that donut
Okay.
hole, and it's progressive. So, you know, over the next
So the donut
6
hole's a little
years,
smaller,
that's right.
and it's getting smaller.
That's right.
Okay.
Right, yep. And the average Maine beneficiary saved over $500 last year because
And
of
that
this.
was last year. Do you anticipate at least that much this year?
Yes, we do.
Okay, because as you said, it's a gradual closing of the donut hole.
That's right.
Anything else?
One of the other things about the Affordable Care Act is additional money was put into the prevention of healthcare fraud.
Okay, which is something that you work on
Yes,
a
that
daily
is-
basis.
that
Is
is
there a
such a-
lot of that?
Across the country, absolutely.
How about in
the
Maine?
numbers vary, but we're looking at upwards of 40, 50 billion dollars a year.
Wow.
Billion with a B. That's a lot of money draining out of the Medicare system. And so, in order for Medicare to still be able to continue, I'm several years away. I want it to still be there when I get there. We need to stop the money from flowing out.
Right, you want the money to go to the people who need it for
Yes.
their medications and for their screenings and all the
Yes,
other
and
things.
so the Affordable Care Act put more money towards fraud prevention. So we're seeing a lot more fraud prevention systems as part of the payment process with Medicare.
Give me one example of a kind of fraud that you see in Maine.
Oh gosh, in the state of Maine, some of the things that we've seen are people receive phone calls from medical supply companies trying to sell them things like diabetes supplies.
Okay.
And they get their Medicare number, they might get their bank account number, and whether they need these supplies or not, they start shipping them to them. Medicare starts paying for them. They may be taking money out of their bank account.
And it's not something they really need.
And it's not something that they need.
Okay, well, good. You keep up. Now I know what patrol means in the title. All right, we have another question. I recently received a call from Medicare asking me to verify my Medicare number and prove my checking account number so that they can issue me a new card. When will these new cards be issued?
Well, you were just asking about
Yes,
what kinds
I
of cases
realize
of fraud
that.
do we have in Maine, and this is one of them. Again, this
So you
is,
don't get a call asking for all
No,
your bank
there-
account number with Medicare.
there is no new Medicare card right now.
Okay, say that
That's
one
a
more
scam.
time. If
There-
you get one of those calls, hang up.
Hang up, because there is no such thing. Medicare is not going to call you and ask for your Medicare number. They already have that information. They're not going to call you and ask for your bank account information. You would not have to pay for a Medicare card, even if they did issue a new one.
Okay.
So the best
But
thing
that's
to
an
do is hang
important
up.
thing, to be aware, and when somebody, red flags should go up.
Absolutely.
They do not need your bank account number. And you're right,
Absolutely.
they already have your Medicare number. Why would they ask it for
Right.
again?
Right, and one of the important things that some people don't realize about their Medicare number is it's their Social Security number. So
And
when
so it opens a lot of doors if
absolutely,
you give it out.
it opens the door to identity theft.
All right. Well, I don't take any meds, so why should I pay a monthly premium for Part D?
That's a good question, and one that a lot of people have asked me. And it is their choice. I mean, it's not mandatory that they have a Medicare prescription drug plan, but I just always like to make people aware that if they decide not to enroll in a Medicare drug plan now when they're eligible, and let's say 5 years from now, they are taking some medications that are quite expensive, they will be able to get a Medicare drug plan. They'll have to wait till October 15th to December 7th, but they are going to be paying a penalty because Medicare, you know, made the rule that if you don't enroll in a plan when you're first eligible.
Can't wait until you need it.
That's right.
Okay. You can get it later, but it costs more.
That's right.
All right, so you got to think ahead, preventive, as you talked about. Let's see if we can get one more in very quickly. Are there any programs that will help me pay for my prescription drugs? I am on a fixed income, so how can I get my meds?
There's definitely programs that can help. There's the federal program called the Low Income Subsidy. And there's also the Medicare Savings Program, which is a federal program that's managed by the state. And both of these programs will help to pay the monthly premium of a Medicare drug plan and lower your co-pays at the pharmacy.
Okay, any other ideas that you have?
Sure, and also if you go to a community health center, they also have prescription drug assistance programs there. So talking with the patient assistance coordinator is always a good idea.
There's a lot of information out there, so if you forget all of this, you can call Spectrum Generations and talk to Gloria and others. And I think you spoke earlier, before we began our show, there are a lot of volunteers out there who want seniors to understand what their options are, whether it's a new plan or how you get prescription drugs. That must be terribly frightening to the seniors you talk with who need medications and really can't afford it. So is that something you see a lot?
It is, yes, we do see that a lot.
I think Medicare is such a complex program that most people don't understand it.
All right, and we're going to help them do that, so please stay tuned. We'll be back with more on Medicare in just a moment. Please join us.
This is the new Hollywood, Hollywood Casino, featuring the heart-pounding action of live table games with Vegas-style blackjack, roulette, poker, and more. Now playing at the place where the fun never stops. From the thrill seekers to the blockbuster winners, here you've got the lead role, because there's no place like Hollywood.
Spectrum Generations, Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both, at Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
Welcome back to Mature Lifestyle. Spectrum Generations is so pleased to bring you programs that make a difference in your everyday life. And today we're talking about something critically important to seniors everywhere, and it's that open enrollment period for Medicare. We have experts here asking questions, answering questions about how you can best get the solution for your Medicare needs, right? So again, Gloria, you're the consumer expert here. Tell us again what the importance of this period is. It runs from when to when, and why does it matter to us so much?
Okay, it runs from October 15th
Yep.
to December 7th.
Yep.
And this is the annual enrollment period, so it's the one time during the year
Yep.
that everyone has an opportunity to make a change if a change needs to be made.
All right, this is the time. Do it now or wait till next year. So this is
right.
Get it done. And it's important, and you're given enough time here to get the information you need, and this is what we're trying to do today. And you pointed out, if you don't make that change, you've got to wait for an entire year, and it has to do with the medicines that you take, it has to do with how much money you pay, and 30 different options, which you will help us understand as we go along. And we're working on our program today with questions, the kinds of questions that come in on the phone every day to Spectrum Generations, and that's why we've chosen to put them on the TV show. So let's get started right away. I've been receiving a lot of mailings from different insurance companies about a different type of Medicare plan. What are these? What are the insurance companies mailing to me about different plans?
It's typically, those are mailings giving people information about Medicare Advantage or Medicare Part C.
Okay, so it's not D, it's C.
That's right.
All right, so let's talk about C for a minute. The insurance companies are sending mailings offering me their product.
Right,
Part
and
C.
it's just a different way to get your Medicare coverage. People will still be eligible to receive all the normal Medicare benefits and services, but how they get them and how they're paid for will be different.
Okay.
It's like managed care. So most people are familiar with HMOs and how they operate. Many of those plans operate like HMOs. They take your Medicare Parts A and B, so your hospital coverage and your doctor coverage.
That's A and B, which we all have. Okay.
And then they bundle it together with some supplemental coverage, so coverage that fills in some of the gaps for things that Medicare doesn't pay for.
Okay, so you can buy a C from an insurance company, which bundles in, as you said, and any gaps that might be there in A and B can cover for a fee, of course.
Right, and some of the plans, many of them do include prescription drug coverage in that, so it's like an all-inclusive plan.
And so you may, if you have a good C plan, you may or may not need a D, which is drugs.
That's right.
All right, so this is what, if I come to you with my particular needs, you can walk through with me what I need to buy.
That's right.
It's not easy though, is it?
It's not, it's pretty complex.
But it's wonderful to have choices out there for us. Okay,
People need to also be careful about those kinds of mailings that they get, because this is a time of year during the Medicare Open Enrollment period when scam artists are also at work.
And they know this is the prime time,
absolutely. And so you have to look very carefully at the mail you're getting, and who are you calling when you call that number. Sometimes you'll get cards in the mail that don't really give the name of a company. They say, call us about your Medicare benefits. And that's a little suspicious to me. People need to be very careful about those kinds of things. They'll often say, mail this card back to us and we'll send you more Medicare information. Usually what that does is you're giving an insurance salesman permission to come and visit you at home. If you don't want that, you shouldn't send that card back. But it could also be some type of scam.
Okay, so you just have to, again, red flags, be educated
Yes.
and talk to people in the know about some of these mailings, all right? And here is another question that has come in. Medicare Advantage plans are appealing, but how do I know if they're right for me? What if I re-enroll and discover it doesn't work? Will I have to wait until next year's enrollment to switch back to original Medicare?
Well, a while ago we talked about some of the changes that happened with
Right.
Medicare because of the Affordable Care Act. One of the changes that they made was to give people the opportunity to disenroll from a Medicare Advantage plan. So if during the annual enrollment period, October 15th to December 7th, you have enrolled in a Medicare Advantage plan and it becomes effective January 1st and you say to yourself, gee, I really am not sure of this, I think I made a mistake. You have the opportunity from January 1st to February 14th to be able to disenroll, go back to original Medicare, and pick up your supplement and a Medicare drug plan.
Well, that's very interesting, but again, it's a short window of time, so you have to be a savvy shopper. There's a window of time for changing your plan. There's another window of time if you have buyer's remorse about Advantage program, right?
That's true. In Maine, we're fortunate in that Maine gives people the first 3 years, so the first time they enroll with a Medicare Advantage plan, in the first 3 years during the annual enrollment period, if they decide that this Medicare Advantage plan is not working well for them, they can switch back to original Medicare and they're guaranteed issue of any supplement plan they would like, and then they can pick up a drug plan.
So that's a consumer protection that is unique to Maine, or Maine is one of the few states that has that.
Right.
Good for you in getting that protection out there. Is there anything else you would like to add about that question that you hear about it in your work? Well, then we'll go to the annual wellness visit. It's been confusing for consumers and for doctors. Can you help clarify the purpose of the wellness visit, and do we still get that under Medicare?
Sure. So the annual wellness visit, as you mentioned, is very confusing and has been both for providers and patients. The goal of the wellness visit is really just to make a long-term preventive care plan with your doctor. So under the ACA, your annual physical...
What's ACA?
The Affordable Care Act.
I'm with you.
The Affordable Care Act did not change anything relating to the annual physical. That still keeps the same cost sharing that you've had in the past.
For your annual physical.
For your annual physical. The wellness visit, it's more of a conversation with your doctor, and it allows you to talk about your medication list, any specialists that you visit, and to go over a health risk assessment, which identifies any other opportunities for connecting you to care that you might need. At the end of this conversation, you'll leave with a care plan and action plan, as well as a preventive screening list, so that you know what's coming up for you in the next year to 5 years.
So part of it stayed the same,
Yep.
your annual visit with whatever payment was required,
Yep.
but this is an additional part, which really makes you more involved with your health care, doesn't it? So it sounds like
It
a
is.
really good idea for your future.
It is, and another piece of the ACA on the doctor side is that they do want patients to be more engaged and involved in their care. Healthcare providers are really encouraged and incentivized to be more patient-centered. So when they ask you, what do you think, or what would be best for you, they really want to know.
And that's a little difficult for us seniors to get used to, isn't it? To ask us what we think about our health care, but I love that trend. I don't know if you can get this in the next minute, but changes for 2013 Medicare. What's coming down the pike? Just a few major things that you see.
Sure. Just very quickly, the Part D prescription drug benefits are still going to continue in the donut hole. You'll receive more and more
more help in the donut
with that.
hole.
Yep.
That's an important thing to remember. So we're going to continue our questions in just a moment, but please stay tuned. We'll be right back with questions and answers for Medicare.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
This is the new Hollywood. Hollywood Casino. Featuring the heart-pounding action of live table games with Vegas-style blackjack, roulette, poker, and more. Now playing at the place where the fun never stops. From the thrill seekers to the blockbuster winners. Here, you've got the lead role. Because there's no place like Hollywood.
Welcome back to Mature Lifestyles. I have some great guests today helping us understand the things we need to understand about Medicare. So I'm going to jump right to the questions because there's so much. And this is a question that has come in. I recently got some things in the mail called Annual Notice of Change and Evidence of Coverage. What are these? And should I just throw them away?
Definitely should not just
Don't
throw them away.
It's not one of those fraud things.
No, this is information that's coming from the plan that you currently have. So whatever you have right now for your prescription drug plan or your Medicare Advantage plan, this is the time of the year when not only do you get to make a change, but the plans get to make some changes, and they have to notify you of what those changes are going to be for next year. And those notifications or that information is in that explanation of benefits, and you should be looking at that so that you know, well, next year, are they going to cover my medications? Because they'll tell you in there
what
medications they're no longer going to cover, and you can see, is it going to be my medication?
So if you're taking a certain blood pressure medication that was covered under your plan and they say, sorry, no more, then you have an opportunity to look for a plan that covers your needs. Is that correct?
That's right.
All right. So it's really disclosure on their part.
It is.
But it's also giving you a lot of responsibility, isn't it?
That's right.
How do you get help with that? I can't read half the things I get in the mail. Can you? Be honest. It's very hard.
A lot of it, no.
And these packets can be quite voluminous.
They are.
My father-in-law just received one a couple of weeks ago.
And it's discouraging, isn't it?
It's a big package, and you open it, and there's several different booklets in there, and
Yes.
you think, what do I do with all of this?
Exactly.
So I think it is important that if people have questions, they call their plan. If they have questions, they can call Spectrum Generations. They can call 1-800-MEDICARE with questions.
I think that's really important to say because sometimes these forms are written only as legalese can write, and it's very difficult for the layperson. Thank goodness you're all there to help us get through this. Now, I want to ask you one other thing. What's the best way to compare Medicare Part D and Medicare Advantage plans?
Well, as Betty said,
Let me make sure I've got it straight now. If I get an Advantage plan to wrap around, I might have drugs covered, but how do I know if that's enough to Part D? Part D is drugs, right?
Part D is just for drugs.
Okay, so
Yes.
how do I compare?
So as Betty said, there's several ways that you can get your questions answered. And one of those ways is that you can, if you're comfortable using the computer, you can go to Medicare's website, medicare.gov. And they have tools there that will allow you to look at the different plans and compare them. You can also call Medicare at 1-800-MEDICARE. And if you're not comfortable with the computer, they can help you over the phone. And you can call your local federally qualified healthcare clinic as well as
we're going to
Spectrum
leave it on
Generations.
that because calling, you're welcome to do. And we hope that you find your answers from our show and from Spectrum Generations, who has been so pleased to bring you this program. Hope it helps.
Mature Lifestyle is made possible by Hollywood Casino. There's no place like Hollywood. And by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
You're watching TWC TV, only on Time Warner Cable.